NHS Dentistry, say unions, is approaching crisis point. More pressure caused by the pandemic means more and more dentists are leaving the sector, creating unprecedented waiting times for patients. This NHS practice in Edgbaston in Birmingham is one of the lucky ones. It managed to keep all of its staff last year, but has had to extend its opening hours to help clear a huge backlog of patients. Bosses say it may not be long before some dentists throw in the towel.
When you're asking your staff to work harder, longer hours, and in circumstances that they're not used to, it becomes very difficult to continue having that conversation with your staff. And at some point they're going to say, I can't do this anymore. I'm going to go and look for work elsewhere.
New figures show that 62 NHS dentists from Birmingham and Solihull left their posts last year. A further 52 quit from across the Black Country and West Birmingham. And in total in the Midlands, 245 left their positions. One person still waiting is Michael Andrews from Solihull. His filling fell out in September 2020 and he's now reliant on paracetamol to manage the pain after failing to fix the problem himself.
I resorted to getting a repair kit from the local pharmacist to try repairing it myself. And it's just an awkward filling to fill in, and I couldn't find out where the filling had come out. So I cleaned the tooth, and the pain subsided. I thought, well, I'll just leave it and see what happens.
But more than a year later, Michael is still in pain and says he's reluctant to go outside of NHS care to fix the problem. Have you thought about going private?
It's just too expensive. And I looked at the prices and I thought, no, it's. I do pay for my own dental treatment, but I wouldn't go private, it's just too expensive.
Prices for private dental treatment do vary, but a study by the consumer website Which found that it can be as much as 10 times as expensive as NHS care.
It is sad that patients are forced into paying privately for their treatment. I would be much happier if all patients could be seen on the NHS, but unfortunately the system is such that there is only so much activity that the government funds.
Financial help for NHS practices was increased during the pandemic to help cater for a lack of patients. But the government says it now expects practices to deliver 85% of their pre-pandemic activity levels and says those that fail to reach that target face being fined. It's exactly that pressure, claim unions, which will see more and more workers leave for an easier life elsewhere. Pablo Taylor, ITV News.